This is as good a time as any to tell you that nothing is what it seems. The power of the secret government over the news media continues unabated. During the time of the Watergate scandals, other scandals of the past were reviewed. But the torture murder of Captain William Morgan in 1826, from which developed an anti-Masonic political party that challenged Freemason Andrew Jackson for the presidency, and the murder of Joseph Smith, the Mormon prophet, which resulted in the men of the Mormon Church withdrawing from Freemasonry, were ignored. That's from Sorcery, Sex, Assassination, and the Science of Symbolism by James Shelby Downard. And that, of course, is in the original Secret and Suppressed Banned Ideas and Hidden History, edited by Jim Keith, which was available from Feral House Press. This is a fantastic book. Hello and welcome to another edition of the Stench of Truth. I want to talk about the solution, in my view, to the healthcare problem in this country. Okay, I support what Ralph Nader supported, and that was single payer, or what is called by some to be Medicare for all, or Medicaid for all. And it's not just the Medicaid system that we have now, or the Medicare system that we have now, which a lot of people would find fault with, and even I would find fault with. It's an expansion of that, and it's a totally different system than what we have now, although that's a convenient way to determine as to what it is. It's single payer national health insurance, and that's what Ralph Nader was for. And the first thing I'm going to talk about is H.R. 676, which is basically the National Health Insurance for Everybody Act, which would give everybody coverage under an expanded and improved Medicaid or Medicare. And there, of course, are a lot of people who have problems with this idea because there are a lot of people who believe in the so-called free market. And I'd be all for private insurance companies being allowed to do what they do to set their cost rates based on, free market actions. But in case any of you are unaware of this, there's no fucking such thing as a free fucking market. It does not fucking exist. Okay? So you need to cut that right out of your argument, right off the fucking bat, because there is no fucking such thing. None. There is no free market. If there was a free market, I would be all for the free market determining rates and letting the private industries handle it. Okay? But there is no free market. There has been no fucking free market for years in any fucking industry, let alone healthcare. So, cut that shit out of your argument right away. If you want to continue to believe that there are free markets in that system, be my guest. I'm not going to disabuse you of the fact. I'm telling you what I believe and what I think is true from my own research. If you don't believe me, that's fine, okay? But I'm going on that basic assumption. No fucking free market! So you cannot have fucking competition because there is no free market. Simple as that. Okay? So why is single payer better? Because you can eliminate a great deal of the costs involved in dealing with private insurers. The entire healthcare system in this country that is so great that everybody loves and thinks is wonderful, and why should we mess with it? You're not going to mess with that at all. The doctors, the hospitals, all of the institutions, all of the people that provide care are still going to be doing the exact same thing they do. You're not getting rid of any of that. All you're getting rid of is an intermediary between you and your care, and that is your insurance company. And if you have a single payer, everybody is treated exactly the same. Well, there are so many people that have arguments against this. Well, aren't we going to have socialized Canada like in, socialized medicine like in Canada? No. Because you're talking about, what? Rationed care where so-and-so might have to wait a little bit longer to get his whatever it is he needs done. I don't think we're going to have that problem in this country. But more importantly, maybe you need to look at what we have right now anyway. Because what we have in this country is rationed care anyway. If you can afford to get the care that you need, you get it. If you can't, you don't. So, in effect, we have rationing already. Okay? So, if you're going to argue that we don't want to have a ration care system, we already fucking have it! So that argument is no good. So why do you need private health insurance companies? They're an impediment to everything, and also they add a tremendous amount of cost to everything. If you eliminate insurance companies, the people that are the gatekeepers of all of this, and then you have a single payer which represents everybody equally, which also can then negotiate terms of payment with physicians, hospitals, and also lower the cost of prescription drugs because you have everybody in it. It would save a tremendous amount of money, reduce a tremendous amount of bureaucracy, and cover a tremendous more people of those who are uninsured now. But I would also have it that if you don't want coverage, you don't have to get it. And then in this HR 676, which, you know, it's a first start. It's not necessarily the end result for this, okay? But it's along the lines of what I think is appropriate. But it wouldn't eliminate the entire insurance industry either, okay? Because you could certainly have insurance companies that provide an extra level of care, that give you access to plastic surgery, that give you access to, you know, any of the other things that might not be quote-unquote medically necessary, okay? They might also give you concierge service. They might give you, you know, access to your own personal whatever, you know, for a period of time. So there's not even a situation necessarily where the insurance industry has to totally go away. They can just provide different services to people who can afford to have something above the medically necessary care function that everybody would get. And with everybody being treated the same way, if you have 100 people going to the emergency room or 100 people going into an HMO and they have the same problems, it's not going to be Joe Blow, the guy who has $10 million, getting care while Jim Smith over here, who's out of work, doesn't. Everybody is going to be treated the same because they have the exact same insurance and they have the same single payer. So they get reimbursed the same amount of money for each person. There's no incentive to treat anybody any better than anybody else. And for those of you who think that the quality of care will be reduced down to a lower level, I'd say that you are not giving the healthcare providers in this country the benefit of the doubt when it comes to having the care of their patients at heart. I think that, well, you can only look for yourself and see that there are a lot of physicians who are for single-payer national health insurance. And why do you think that is? Because it gets the bureaucracy out of the way of the physicians so that they can then decide on what care is necessary for you without the bureaucracy and the paperwork and everything else of dealing with a multitude of private insurance providers. So do a little research and find out that maybe it's not as bad as you think. Maybe it's not a socialized medicine. Maybe it's not ration care. Maybe it's not all of those bad things that people try to tell you it is. And maybe you can look at it and see that maybe it does have a little bit of something to offer to it. Single payer for everybody. Look into it. Check it out. If you don't like it, that's fine. I mean, that's what I view. I look at it as being a solution, you know, and certainly not this patched together bullshit that we have from the Obama administration right now. It's not going to address underlying issues. It's not going to reduce costs. It's not going to be any kind of reform. Period. I mean, that's my take. I wish more people would be interested in this whole healthcare thing. I know a lot of people think about it in the back of their minds, but it's not in the forefront. It's not in their activist mode that they think about this, and they should, because it's a really, really important issue, and it would define this country if we handle this correctly. Thank you. Good night.